What's going on, everyone? Welcome back to my channel. In today's video, we're going to be looking at exercises for a stiff knee joint. So if this is something you're struggling with, stay tuned for the exercises ahead. When we look at the knee joint, there are several movements that we need to consider. Most people think of their knee joint as kind of a simple hinge joint where it just goes forward and backward, and those are two movements, flexion and extension. But our knee joint is actually a little bit more complicated. It's called a condyloid joint, which means that not only can it go forward and backward, these kind of hinge-like movements, but when our knee is in a flexed position, it actually has internal and external rotation as well. So we have those four movements available to our knee joint, and then our kneecap, of course, sits on top of the knee joint, and that forms the patellofemoral joint, which is another joint that we need to have good mobility in order to move through full range of motion with our knee joint. Our kneecap slides up and down as we flex and extend our knee joint. So in today's video, I'm going to show you a number of stretches and mobilizations to address all of those movements so that you can get your full range of motion back. The first two movements we're going to look at are flexion and extension. So flexion is bending your knee. One of the easiest things to start with here is just a heel slide. So you're just sliding your heel. You can do this on the ground or up on your bed if it's difficult to get on the ground. But you're just going in and out, bending as far as you can, and then straightening as far as you can. If you have limited flexion, the ability to bend, what you can do when you get up to this point is then take your arms, or you could wrap a sheet or a towel around your leg and then just pull it in until you hit that point of sort of tolerable discomfort. You don't want to pull way into pain, but go to a point where you feel a stretch, some discomfort, and then try to hold it there for a little bit. When we look at improving joint mobility, there's a concept called total end range time. So if I'm at my end range position, the more time I can spend there, the more likely I am to gain mobility. Some of the research we see, they'll have people do 30 minutes of stretching a day, so 30 minutes in the end range position. So usually this will become uncomfortable after a little while, so maybe you hold it a minute or 2 minutes, give it a little break, kind of shake it out a little bit, and then maybe you bring it up again and hold again for a few more minutes, and maybe you shoot for somewhere in that 10 to 30 minutes of hold time a day. So that's flexion. You want to get all the way up compared to your other side, but for the knee joint, normal is about 135 to 145 degrees of flexion. This will vary for everybody, and if you've got arthritis or something, you might not get that much bend, but just work on it, and if you work on it every day, it should improve. With extension, you want to go down here and try to get all the way straight to where the back of your knee, this is called the popliteal fossa, where basically it almost touches the ground. And again, people will vary a little bit here, and you can compare to your other side. To stretch this, what works well is to take a book or some kind of elevated surface, or maybe you have a coffee table. You're just going to put your heel out on that elevated surface and then let gravity pull your knee down into extension. This is a really easy way to get that total end range time. Just let it hang out here. Maybe you're watching TV and you can just let it sit. Maybe you can do a 5 to 10 minute stretch. Again, if you have some stiffness and some pain, this will probably get to be uncomfortable and you'll have to kind of shake it out of there, maybe use your hands and give it a little break. It often is uncomfortable to come out of those positions when you've been stretching. But you just give it a break and then maybe right again there for another stretch, or later in the day, you go for another stretch. This is the type of thing where if you can do it 3 to 5 times a day, all these mobility exercises, and do them every day, you'll tend to gain mobility faster. Okay, so those are our first two, looking at a heel slide and a static extension stretch to improve our flexion and extension range of motion. For our next two stretches or mobilizations, we want to work on internal and external rotation at the knee joint. This is basically the tibia spinning on the femur. So basically our shin bone spinning on our thigh bone. This will only work with your knee in a flexed or bent position. Once our knee is straight, it locks out and we lose those rotational movements. So we're going to put our leg in about 90 degrees of flexion. And if we're working on internal rotation first, which is sort of, you kind of put your heel on the ground and then you're going to kind of spin in, turn your foot in, and that will create a bit of tibial internal rotation. To help that, I'm going to take my hands and kind of grab around my upper leg and then help that tibia basically turn inward and kind of stretch it like that. I can kind of oscillate. It's almost like a self-mobilization. This is very similar. If you came into the clinic, we would mobilize the joint like this. So you can hang out here like the flexion extension stretches. Hanging out for a few minutes will increase that total end range time and help the joint become more mobile. For external rotation, you do just the opposite. So now I'm going to turn my foot out. You can see my tibia move when I do that. It kind of spins both directions. It's not a huge degree of movement, but it does move. And you'll get more movement with external rotation. So turn that foot out, pivot, and then use your hands to spin in this kind of counterclockwise motion to improve that external rotation of the tibia. These ones aren't going to be quite as important as the flexion extension for most people, but working them can help with the flexion extension movements, these kind of accessory movements that occur in our knee joint. So just work them back and forth, and it should help to loosen up your knee joint overall and improve your mobility. Okay, so we've got tibial, internal, and external rotation mobilizations. Before I get into the next set of stretches, just want to mention my book is available on Amazon and Barnes & Noble. It has rehab programs for the 50 most common orthopedic conditions we would see in physical therapy. Each body region has its own chapter. If you have a stiff knee joint, one of the best programs for this would be the arthritis program in the knee chapter. So this program is going to take you, like all the programs in the book, through 3 phases. It's going to have pictures of me doing all the exercises and instructions. It'll progress through different things like stretches, soft tissue mobilizations, strengthening exercises for the hip and the knee joint in this case, and be much more comprehensive than, say, a YouTube video with just a few exercises. So if you'd like to have a resource that allows you to do all of your own rehab at home, I will put a link for the book down in the description. All right, the last thing we need to focus on is the patellofemoral joint, that kneecap joint. When people have limited knee mobility, oftentimes the patellofemoral joint gets to be stiff. And like I said at the beginning of the video, it needs to slide up and down when you bend and straighten your knee. And if the kneecap gets stiff, it will limit your overall knee movement. So what you're going to do here are just some simple patellar mobilizations. You want to do these with your legs straight. That's where the kneecap is going to move the most. So it feels a little funky to do this, but all you're going to do is take your fingers, kind of wrap them around the perimeter of your kneecap, and then you're going to push it up and down. So you're just kind of gliding it. We call this a superior and an inferior glide. So you can kind of push it down and oscillate a little bit. You can do the same with pushing it up. Basically, when we bend our knee, the kneecap needs to slide down, and when we straighten our knee, the kneecap slides up. So it needs to have that movement. You also can work on medial and lateral mobility. So the kneecap needs to be able to go side to side a little bit. This is going to feel a little strange at first. A lot of people don't like feeling their kneecap moving around. That was often when people would come into physical therapy and we would do this on them. Some people would even feel a little almost a little nauseated doing this, but if you can tolerate it and get kind of used to it, mobilizing the kneecap and the surrounding skin and fascia and soft tissues can really help with overall knee mobility. So just spend a couple minutes on this, maybe 2 to 5 minutes once a day, just kind of working on that kneecap, that patellofemoral joint mobility, and that will help with your overall tibiofemoral, that larger knee joint mobility. Okay guys, those are the most important mobility exercises to work on if you have a stiff and painful knee joint. If you have any questions, put them down in the comment section and I will get back to you. See you in the next video. Bye.